Cut your finger, normally does your finger heal? Normally it should, okay? Now, the body is designed to heal itself. Are we okay with that so far? Okay? When the body is not healing itself, that means something is not working correctly. Are we okay so far? We are, right? Okay? So everything that we have been told has been really put on the back burner by a lot of people. Now, that being said, okay, what we need to do, Chelsea, can you show her where it is? Yeah. So that being said, when we have a symptom overall, you go to your doctors. How many doctors that you've been told to say, hey, take a medication? Who's been told that? Yeah, we've been told that, okay? Who has been or ever taking a medication to cover up the symptoms of another medication? Okay, have you guys ever heard of that? Yeah, when medications have so much side effects, right? You have to take other medications to try to cover one up, okay? So that's one of the reasons why I started doing what I do, okay? Now, Dr. Oz, you guys know Dr. Oz? Dr. Oz came out and said, diabetes is preventable, okay? It's even treatable and reversible. 90% of all type 2 diabetes can be reversed, all right? What's number one cause of neuropathy? Diabetes. It's the number one cause, okay? When you are diagnosed as diabetic, the moment you are diagnosed as diabetic or even borderline diabetic, you have up to a 70 to 80% chance of getting some form of neuropathy, okay? I mean, your chance of getting it's really, really high. But most people don't understand why. We have medical doctors and neurologists that refers patients to us because they don't really know why they get it. And if the patients get it, they say, well, once you got it for life, you see. In our office, that's absolutely not true if you understand how the body works. This is a pretty complex picture, right? If you try to sit here and understand it, it's like pretty complex. But here's the thing. Anytime you have pain, it has to run through the nervous system. The nervous system, to simplify it, you have the brain and you have your spine, okay? From the spine and the spinal cord, you have nerves that branches out everywhere else. Are we okay so far? Yep. Okay? Well, here's the thing. Anytime you have pain, that means it has either affected a nerve, it has compressed a nerve, or pinched a nerve somewhere. All right? You cannot feel any pain if it did not affect a nerve. For example, heart attacks. Okay? What's the first sign of a heart attack?
Chest pain.
Pain, right? Pain. Chest pain. Why do you have chest pain?
There's a blockage.
There's a blockage. The first sign of a heart attack is because you're having a heart attack. Okay? First sign. 50% of the people who have heart attacks don't make it. But that's the first sign. Why? That's because when you had it, that's when it affected a nerve. And you felt it going down the arm. But it's been building up that whole time, right? See, you didn't feel it building up. So think of a cavity. By the time your tooth hurts so bad, you go to the dentist and they looked in the cavity. Did it just happen yesterday? No. How long has that cavity been building up? Months. Sometimes years, huh? Right? It's been building up for a long time. So we have pain in different areas. In front of you, there's a survey. Okay, I'd like you to fill it out. All right? Because it allows me to know more about you. Knee, shoulder, or hip pain. Right? It's affected a nerve. Right? It changes your mood. Who's realized that pain can put you down? And if you start with pain in the morning, you're maybe not as positive as you could be. Yeah. And who knows that it not only affects you, and maybe some of you have experienced it, it affects those around you as well, friends and family. Are we okay with that? Yeah. See, let me ask you this. You have choices, right? And after the end of tonight, my goal is to have you do something different. Because what you have done so far has gotten you here. And if you keep doing the same thing over and over again, Einstein called it insanity, right? Doing the same thing over and over, expecting a different result. I might even have that slide, I think, coming up next. Okay? But overall, when you look at it, okay, if I were to be able to show you how to take care of your body, okay, how to get better, and do it in a natural and affordable way, who would want to do it? So let's take a look. We got to understand what is peripheral neuropathy. Who thinks they have a good understanding, a good grasp on what peripheral neuropathy is? All right? Okay. Who's ever read up on something? Okay. Who's watched my webinar? Nobody. Okay. I don't blame you. It's an hour-long webinar, okay? So, but what is peripheral neuropathy? It's a nerve symptom, okay? Nerves, brain, spinal cord. This is a little bit easier than that nervous system picture I put on earlier, right? Okay, you got the brain, you got the spinal cord, you got nerves, all right? And here's what happens. Around your nerves sits blood vessels. Every single nerve have blood supply. That's how you get oxygen, okay? I mean, your hair has blood supply, right? Your hair follicles, that has blood supply. But what happens is in neuropathy, the blood supply starts, something is killing off the blood supply around the nerve. So if you kill off the blood supply around the nerve, what do you think happens to the nerves? They die. They start to die, right? Yeah, okay? So when they die, what do you feel? Numbness, some tingling, right? Prickling, okay? Some burning. Who's felt some of this? Or one or more, right? Okay, right? Now, when we go to the doctors, what happens usually? This happens, doesn't it? You go to the doctor, oh, you have peripheral neuropathy. Who's ever gone through that shock test? Oh, brutal. Brutal shock test. The problem is that shock tests don't even really tell you whether or not you have peripheral neuropathy. Okay? A lot of times, that shock test is a 50-50. You can have peripheral neuropathy. The shock test came back, oh yeah, your nerves are good. Here's why. It's because that shock test only shocks and tests your large nerve fibers. It doesn't test the small little ones that comes off of it. And that's why they have to put the pin here to up here. Okay? Oh, let's see how fast you feel it. Okay? Neuropathy, 90% of the time, only affects knee and below, or forearm and below. There's a 10% it could affect other places. 90% of the time, here and below. And I'll explain to you why. But here's what happens. You have it, now you get prescribed some anti-seizure medication. Who knew that these are anti-seizure medications? Gabapentin, Neurontin, 2 people, right? How did they get to that? It was an anti-seizure. I want you guys to understand. A seizure is when someone has an overactive brain, right? Too active, the brain gets hot, you seize out, right? Anti-seizure lowers the activity of the brain, okay? Lowers the activity of the brain. It's turning your brain dial down. So what happens when you turn the brain dial down? You feel less pain, right? But what else happens? You get a little sleepy, you get a little forgetful, your balance is off now, right? Okay, you can't control sometimes your bowels, and everything. Intimacy starts being affected. Your brain's turning off. The more medications you take, the more your brain starts turning off. It's like me starting to dim the lights. Okay, after a while, you guys will bump into each other walking around in the dark. But that's what happens. And that's why the medication has to increase, because here's why. Neuropathy affects the blood vessels. Okay, I want a lot of you to understand that. It affects the blood vessels surrounding the nerve. Whatever the cause is, that's usually how it starts. Well, the nerve, when there's a nerve problem, it's going to send a signal to your brain, right? So pharmaceuticals figured out if I turn down your brain, you might not feel your feet as much. But the body is smart. The body compensates and says, hey, he's not listening to me. I'm going to give him more pain signals. When the pain signal breaks through that medication, what do you think you have to do now? You got to increase that medication. Okay, eventually, like for example, gabapentin, right? The maximum is about 3,600 milligrams. Once you get past that 36, neurologist is like, well, we just got to knock you out now. Stocking or glove-like pattern, right? Elbow and below, knee and below. People ask me why, and I said it's very simple. Above your elbow and above your knee, you have huge arteries, huge. Femoral artery over here, a brachial artery over here. But that and below, you have small arteries. That's why in neuropathy, it starts affecting from the furthest to your body, furthest away to your heart, from your heart, and it works backwards. As it gets worse, it goes up. Okay, it works towards your heart, all right? Because it's a blood flow problem. Where do you get the least amount of blood flow? Furthest away from your heart. Making sense to everybody so far? All right, very good. Okay, lack of oxygen, okay, it kills off the nerves. So from there, the nerves, because of the blood vessels dying off, you start getting worse and worse nerve flow, okay? Are we okay with that so far? Yeah, okay? Now, just like a plant, a dying plant, a plant needs what? Soil, right? It needs water. It needs light, doesn't it? Okay? Now, just like your nerves, it's very similar. You need blood flow. You need oxygen. You need nutrition, right? Are we okay so far? Yeah. Now, here's the thing. But in the case of a dying plant, who's ever gardened before? Yeah, who's got plants around the house? You know sometimes you can save that plant by giving it the right food, the soil, water, and sun, right? Now, who also knows that sometimes the plant has gone too far and you can't save it? I'm going to give you that number right now. When we do our exams, if you hit this number, there's not much I can do. I'm very honest with that. The number is 85. If you have more than 85% nerve loss, peer-reviewed studies show there's not much anything that we can do to bring that life back of the nerves. Okay? So, moving forward, if we catch it in time, what's that number? 85. In time, we're able to bring the blood vessel back. As the blood vessels brings back, your nerves come back. As your nerves and your function comes back, what goes away or starts going away? The pain, the numbness, the tingling, the burning. You see? Does it make sense to everybody? See, we're going after the cause. The function is what we have to do. What's the number one cause? Diabetes. How does diabetes affect this? Most people don't realize how it actually happens. Very simple. What is too much in the blood with diabetes? Sugar. Sugar, think of it like acid for your plumbing and pipes. What does it eventually do? It eats away and breaks down your blood vessels, right? So too much sugar in the blood over time breaks down your blood vessels. Where does it start? Furthest away from your heart, right? So the blood vessel starts breaking down. You guys ever heard of people getting ulcers and amputations with diabetes? That's because you have so little blood vessel, if you get a cut or a nick, you can't heal anymore. You don't have enough blood flow to heal. So it becomes an ulcer, okay, becomes necrotic, the death of the tissues, and if it gets becoming bad enough and it affects the bone where it can potentially travel, what do the doctors have to do? They got to cut. Okay? Do you guys have a good understanding of how that happens now? But during this time, hopefully before you get to here, your body is smart. Your body's going to say, hey, there's a problem with your feet. Okay? It's going to light you up. Fire, tingling, numbness, burning, pain, okay? It's going to tell you something's going on. But at the beginning, you're like, oh, I think it's just ants on my feet. I don't know what it is, right? Now, do you think you have to be diabetic to get neuropathy? No. As a matter of fact, half our patients are pre-diabetics, okay? Because what does diabetes mean? That diabetes means you have a certain level of sugar in the blood, right? Before you become a diabetic. Once you go a diabetic, oh, you're not never getting off, right? But here's the thing. Our body heals. If you give it the right stuff, it can heal, okay? Your body is a reflection of everything that you've done in the last 9 to 12 months, roughly, okay? Every 7 years, you have a brand new body. Your liver, did you know your liver replaces itself? You get brand new liver cells every 40 days. Your red blood cells, completely different every 4 months. Your stomach lining, okay, that's digesting all your food, every 5 days you get a brand new one. Okay? Your body's consistently changing. How are you going to tell me that if you make the differences that you're supposed to make, that your body doesn't actually do what it needs to do to create a good, normal, harmonious, natural, functioning body? It doesn't make sense, right? What in the world did we do before this for thousands of years? Huh. Now, the next thing is chemotherapy. Why? Because anytime you give chemotherapy, chemo kills the bad cells and what? The good cells. This stuff is injected in you, okay? And it's very toxic, and it goes everywhere. That's why people lose their hair. Why do you think people lose their hair? They lose the blood vessels surrounding the hair follicles. It's killing the blood vessels. Hair falls off, right? But also, up to 40% of people who get chemotherapy and radiation ends up with some form of neuropathy. But that's rarely told to the patient. This is the one that can travel throughout the whole body because this was injected into your veins to begin with. So it can travel. And this is one that most people will also get autonomic neuropathy. Now, we're talking about peripheral mainly tonight, where it affects the hands and feet. You guys, maybe a lot of you have never heard autonomic neuropathy. Autonomic neuropathy is where the blood flow starts cutting off your organs. What happens when your kidney starts failing? Your proteins get out of whack. Kidney protein, huh? Dialysis, dialysis. Okay? What happens if your liver doesn't work? Your body becomes toxic. What happens if your lungs don't work? COPD, asthma, okay? Toxicity of chemotherapy, right? Then there's age-related idiopathic neuropathy, all right? Now, this is a term. What does this term sound like? Idiopathic. Stupid. If I cover the pathic, right? Sounds like kind of idiot, right? That's where it came from, the word. When the doctors and no one could figure out, oh yeah, I don't know why you have it. We're going to call it idiopathic neuropathy. Age-related idiopathic. It sounds smart though, doesn't it? It sounds really smart. Ooh. And then you look at it and be like, wow, I don't know what it is. Okay? They don't know what it is. All right? 80 to 90% of our patients who were diagnosed with this, I end up figuring out it's either their lungs not working, their heart not working, okay, or some form of problem is happening along their spine. Okay? Because I dig. I'm not just going to stop at idiopathic. Something, you were smart enough to be born from 2 cells into trillions of cells. Your body is not that dumb to just automatically give you neuropathy. Okay? I don't believe that. Because sometimes it could be postural problems that mimics neuropathy. See, that's why we built our practice and we have digital x-rays. Because if I don't feel like you have neuropathy, and we've got a number of patients that's had that, and I said, let's take an x-ray. Let's figure out if you have a nerve pinch somewhere. You see, And a lot of times that's what happens, right? But there's other causes. Statin, cholesterol medications, okay? That's a high prescribed population, 50 and above. That contributes to it. Alcohol, okay? This is by far the number one reason when patients come in and they say, Dr. Tam, I've had it for 5, 10 years. Doctors can't figure it out. I don't have diabetes. I don't have chemo. I don't have anything. And then the question comes up, do you consume any alcohol? 2 years ago, I remember it vividly, okay? Husband and wife sitting in your seats. I pointed at this. She nudged him, okay? During our consultation, he's had it now. I want you to know this. 3 years. So, but whatever the cause is, it eats away the blood vessels. How it happens is the same, right? It eats up the blood vessels, the nerves starts to die off, and you start feeling these, okay? All right? That's how it works. When you lose oxygen, you feel that, okay? Now, just like going to the doctors though, going back to that. Why do I revisit this? Is because I believe this is a huge problem in America. Not just for neuropathy, for arthritis, for all the other diseases as well. There's a lot of what tied in? A lot of money tied in, okay? As opposed to some countries in Europe, certain countries in Europe bonus their doctors when their patients' labs, blood pressure, weight, BMI are better. In the US, we're completely opposite. The more prescription medications you fill, okay, the more money doctors make. It's a kind of, I don't want to say corrupt, but it's a reverse system, okay? Whose doctor has ever gotten mad at you before for not filling your medication? All right? You've heard of that sometimes? Yeah. Oh, I didn't fill. Oh, why didn't you fill it? As a doctor, if you don't have feeling in your feet, they're obligated to take away your license. We had a patient that had their license taken away, couldn't drive. And he says, Dr. Tam, there's nothing more. I've been driving ever since I was 14. I said, 14? But he's like, and I'm in my 80s now. That's taking away a huge part. Who thinks that not being able to drive is a huge disability? Huge. He's like, I just need to drive. I need to get you to get me back driving again. I don't need to go, I'm not trying to take a trip here, go places. You know, he says, I heard that at your seminar, I just want to drive. You know, and within 6 months, he was driving again. Okay, now we had a celebration, he had a celebration. Okay, so there's 3 factors in determining. Number 1, what is the cause of neuropathy? That's huge. Okay, we got to figure out the cause, right? Number 2, how much nerve damage has been sustained? Okay, I'm not going to put shockers and needles and shock your leg. I'm going to test it. It'll be hot, cold, balance, different things. Do you guys remember that number? 85. All right? And I pray to God that you're under 85, because past 85, there's nothing I can do. Okay? Then, how often do you have to do the treatments? Okay? And after that, we look at our approach. Number 1, it's got to be everything that we do in this office, so you know, it has to qualify with these 3 things. It's got to be safe, it's got to be natural, it's got to be effective. Any time that violates any of our treatments in our office, that violates any of these 3, it's just no way that we'll do it, you see. And that's the benefit of having a practice that we run, is I get to figure out what the best protocol, the best outcome for the patient. I don't have to follow, okay, a pharmaceutical telling me, oh yeah, you know, if you do this, you know, you'll get paid this much. Okay. Some people ask me all the time, well, Dr. Tam, is this covered by insurance? It's not. Okay. And because if it was covered by insurance, you would have gotten better by now. I promise you that. The doctors would have figured it out by now. See? But I think a lot of good information sometimes in mainstream medical is suppressed so that, well, you can get as much medications as you can. Number 1, you got to improve blood flow, right? I've talked about blood flow until you guys know it's blood flow now, right? Okay, that's the cause, lack of oxygen. We got to improve blood flow. We use infrared diode technology that was invented by NASA back in the 40s. NASA got it in the 40s, The Navy had it for their submarines because they realized when they sent people to space, there's no oxygen up there. They can't heal. So they invented these lights and infrared diodes to increase blood vessels. It's a process called angiogenesis. They have a name for it, okay? And then there's different technology that we use. This was the Nobel Prize discovery, the role of nitric oxide. So we got to increase that in the body, all right? Special vibration therapy that we use, okay? Now, we've had patients that tells me, well, Dr. Tam, I got a foot vibration that massages my feet and everything. I said, watch out. If you only know the frequency of what you're using, then okay. Who's ever mowed the lawn before? Okay, who's ever mowed the lawn where sometimes your hands get numb? Right? Do you think that's good for you or bad for you? Bad. Because at a certain frequency, it's vibrating too much where you're losing blood flow. That's why you got to shake your hands off. All right? So more is not better. Okay? More is not better. Too low, nothing happened. Too much, you're getting worse. You see? You know? Then there's the nutritional aspect. I got to show you how to eat. How do you heal yourself from the inside? Because a lot of foods cause inflammation. Okay? It can cause pain. I'll give you a tip right now. All right? Who has heard of foods called nightshades? No one. Boy. If you've got inflammation turns into pain, you've got a problem and you need to stay away from nightshades.